What is up, guys? Welcome to another video on my channel, HAIRLICIOUSLY. If you guys are new to this channel, please make sure to subscribe and stay tuned for hair transplant and hair loss tips. So I'm back from Thailand and I have another video for you guys. Today's video is going to cover the topic of electric microneedling versus manual derma rolling and their respective effectiveness. As you guys are aware, derma rolling and microneedling, which is the process of creating tiny puncture wounds in the skin, has been around for decades and it's been proven to treat various ailments, anything from wrinkles, stretch marks, hyperpigmentation. A lot of people use it for acne scars, and most importantly for this video, it is for androgenetic alopecia, commonly known as male pattern baldness. So the most compelling study to back this up was actually done in 2013. And I actually did a video on this last year, so I'm going to be leaving it in the description box for those who want to revisit the video and see the benefits of derma rolling for hair loss. Pretty much to sum it up, for those who are new to derma rolling, the 2013 study had two different groups. We had people suffering from a NORD 3 to a NORD 4. The first group was offered a weekly microneedling treatment with 1 milliliters of 5% minoxidil twice a day. And group 2 was only offered 1 milliliters of 5% minoxidil twice a day. So after 12 weeks, hair count at week 12 was significantly greater for the microneedling group plus the minoxidil, which was at 91.4 hairs, compared to a group that was just using minoxidil, which was at 22.2 hairs. Patient evaluation also supported this, where nearly 82% of patients reported more than a 50% improvement versus just 4.5% of patients who were only using minoxidil. This does work, and we know for a fact that derma rolling in conjunction with minoxidil is far superior than just using minoxidil by itself, and derma rolling is a safe and promising tool in the hair stimulation for those who are suffering from hair loss. Now, 1.5 millimeters of derma rollers were used over the affected scalp in a longitudinal, vertical, and diagonal direction until mild erythema was noted. That just means that it was redness that was present on the scalp. The study doesn't indicate how many minutes each patient was using the derma rollers on their scalp. They were also instructed not to use minoxidil on the day of the procedure where they're using derma rollers, and to resume it 24 hours. And this is to prevent it from going into the body. A lot of people think that minoxidil and derma rolling are used so that it can actually improve absorption, but that's not true, because if you do use it right away, there's a lot of people that do suffer from side effects such as heart palpitations, dizziness, and so you always want to wait at least 24 hours until you start using derma rolling right after minoxidil. Okay, so per the study, derma rolling to induce hair growth works by the following mechanism. The releases of platelets-derived growth factors. Epidermal growth factors are increased through platelet activation and the skin wound regeneration mechanism. And the activation of stem cells in the hair bulge area under wound healing conditions, which is caused by the derma roller, and overexpression of hair growth related to the genes vascular endothelial growth factor. We have beta-catenin, Wnt3A, and Wnt10B. And most of you guys know, who are subscribed to my channel, that derma roller is one of my main arsenals in combating further hair loss. And it's very easy to use, it's inexpensive, it doesn't take too much time, and studies back it up. It's a proven method which works without adverse side effects. I know a lot of people don't want to use certain drugs like Finasteride or Finasteride because of the effects that it has on the hormones. So I wanted to push it one step further and see how the electronic microneedling versus the manual derma roller compares with each other. So for those who don't know the difference, they actually work in the same ways, where they increase collagen, increase blood flow, and it creates new skin cells. So here's the derma roller that I use, and actually a few weeks ago I started using this thing here, which is the electronic derma roller, or the electronic microneedling. It has about 12 needles, and you can have various settings here. I'm going to be doing a separate video on how to use this, but it pretty much looks like this. You hook it up to an adapter, and what it happens is you have needles on the inside here, which pretty much jab versus rolling. There really wasn't any studies that directly compared the effects of derma rolling versus the electronic microneedling, strictly for hair loss. But I was actually able to find a study that tested the effectiveness that it had on treating trophic acne scarring, which is when the skin is unable to regenerate tissue. While it's still effective, the issue with manual derma rolling is that some people find that it's more painful to execute with erythema, and it lasts longer compared to the electronic microneedling. And the character of the micro wounds seen with the derma roller is much more traumatic to the skin. So instead of rapid vertical needle insertion and withdrawal as seen in the electronic microneedle device, the derma rollers tend to dig into the skin and create more of a tearing wound, which may be responsible for a longer downtime. So since you are going this way, not everything's going to be perpendicular to your skin or the scalp. So there was a study presented at the Australian Medical Conference in 2012 led by Dr. Chu, who is a leading UK dermatologist, and he compared 1.5 millimeter derma roller with the microneedling of 1.5 millimeter head to head on atrophic acne scarring. And patients using derma rollers were using this 4 times vertically, horizontally, and diagonally, which resulted in about 250 channels per centimeter squared. High pressure wasn't really required and pinpoint bleeding was achieved. The microneedling pen used circular motion, something like this, then horizontally and vertically 4 times, which resulted in 80 channels per second. The interesting thing here is clinical evaluation via digital scan technology showed a greater reduction of scar depth. So patients found that electronic microneedling treatment was found to be less painful, shorter downtime, and better clinical outcomes. I'm not saying derma roller isn't effective because it's already proven based on the 2013 study that it's proven to work, and it works even better when it's used in conjunction with minoxidil. But sometimes the issue with derma rolling is that it requires small amounts of pressure during rolling to ensure proper microneedle penetration. The pressure can never be the same between individual users, so depth of penetration can vary to some degree, while the electronic microneedling device exerts force in a lateral motion perpendicular to the skin. And theoretically, different penetration depths have different therapeutic effects on the skin and the scalp, so the ability to create consistent perforation patterns may hold the key to therapeutic value and versatility, and studies do indicate that better and improved reduction of scars imply that the electronic microneedling superiority when compared to derma rolling, which in turn means that it's going to be a better way of producing epidermal growth factors and skin wound regeneration. It's also going to improve the activation of stem cells at the hair bulge area and the overexpression of hair growth related genes. So like I said, I'm going to be doing a video strictly on how I use this. I've been using it for a couple weeks now. It just came in the mail. And so I'm going to be showing you, doing a demonstration of how I use this. And I'm also going to be doing a before and after and going ahead and explain to you guys exactly how it works and what benefits that I've seen from using this over this. But like I said, derma rollers are still useful. It's obviously a lot cheaper to use. I'm not saying that you guys shouldn't use this, because I do use this as well, but I wanted to test this out because based on studies, it does show that it improves scarring, and when it does improve scarring, it means it does a better job of the wound healing process. So if you guys are interested in purchasing the derma roller, I do sell it on my website at HAIRLICIOUSLY.com. You guys can check it out. I'm also going to start selling the electronic microneedling device. You guys can also check it out on HAIRLICIOUSLY.com, but I will be doing a comparison between these two. I'm going to be testing it out. And my next video, I will be showing you guys exactly how it's done. And one last thing, a lot of you guys have been asking me, why am I doing derma rolling when I've already had a hair transplant? Why am I taking Finasteride? And I just wanted to cover this topic, once again, because just because you had a hair transplant doesn't mean that you're not going to suffer from further hair loss. It just means that whatever areas that you got your hairs implanted, that area is most likely not going to be affected because it's from the hairs in the back of the donor zone, which is resistant to DHT. Now, the hairs behind it, you still need to do something. So this is the reason why I'm taking Finasteride. This is the reason why I'm taking minoxidil. This is the reason why I am derma rolling. This is the reason why I take various supplements such as Biotin, pumpkin seed oil. I'm very careful when I look for different types of shampoos that don't have various sulfates, parabens, any other chemicals that might harm my hairs, because just because I've had a hair transplant doesn't mean that I am not going to suffer from further hair loss. So I just kind of wanted to get that out of the way so that you guys can have a better understanding of all these arsenals that I use to prevent further hair loss. But thanks for watching, guys. If you guys have any questions, make sure to leave me some comments. And if you guys did start using this, please let me know what your outcome was. If you guys did use both, I want you guys to leave me some comments and do a comparison. Let me know what you guys think. And I'll talk to you guys next time. Take care.